Hello and welcome. This is your friend Parinita Rohrra on Celebrate Life, Celebrate Pregnancy. Let me first begin by congratulating you for the great good news that you have given us. I'm here to discuss about all that one goes through in their 40 weeks of pregnancy. Yes, pregnancy lasts for around 40 weeks, that is 280 days. Beginning from the first day of your last period. Most women go into labor on the either side of this date, that is in the 39th week or the 41st week. Now, these 40 weeks are divided into 3 trimesters. The first trimester that begins from 1st week to the 12th week. Second trimester begins from the 13th week and lasts till 28th week. And the third trimester begins from the 29th week to the 40th week. There are some exceptional cases where women go overdue. Now, if a woman does not go into labor by the time she is 41 weeks pregnant, there is a procedure called membrane sweep, in which an internal vaginal examination is done, which stimulates the neck or the cervix of the womb, which produces hormones that triggers natural labor. Now it is said that this can be avoided, and another option is induced labor. Now just in case you reach the 41st week of your pregnancy and you still do not want labor to be induced, your baby and you will have to be continuously monitored with ultrasound scans and for the baby's movement and heartbeat. Induction is always planned in advance. It is always offered to women who don't go into labor by 42 weeks. Now let's quickly understand what one may experience in the first trimester. Your body slowly undergoes many changes. These are hormonal changes which affect almost every system and organ of your body. These changes further trigger symptoms even in the very first weeks of your pregnancy. Now, besides the stopping of your periods, which is almost always a clear sign that you are pregnant, other changes may include extreme tiredness, tender swollen breasts, your nipples might also stick out, upset stomach with or without throwing up, that is morning sickness, cravings or distaste for certain foods, mood swings, constipation, that is trouble having bowel movements, need to pass urine more often, headache, heartburn, weight gain or loss. Since your body is undergoing changes, you must consider making changes to your daily routine as well, such as having small frequent meals, going to bed early and so on. Slowly and gradually your first trimester will pass and all these discomforts will go away. And it is not necessary that you will experience all these discomforts. You may not experience any of them. It is also not necessary that you will feel the same way when you were first time pregnant. Each and every pregnancy is different and has some variations. Some symptoms like nausea and fatigue or tiredness go away, but there are other changes happening. Remember, your baby in there is growing, so obviously it needs some space. So slowly and gradually your abdomen will expand. Your body is changing to make space for it, and these are the few things that you may go through. Body aches such as back, abdomen, groin or thigh pain, stretch marks on your abdomen, breasts, thighs or buttocks, darkening of the skin around your nipples, a line on the skin running from belly button to pubic hairline. You may also see patches of darker skin, usually over your cheeks, forehead, nose and upper lip. These usually match on both sides of the face, and these are sometimes called mask of pregnancy. Numb or tingling hands, called carpal tunnel syndrome. Itching on the abdomen, palms and soles of the feet. Now along with itching, if you happen to have jaundice, or if you feel that you are losing appetite, or even if you have vomiting, nausea or fatigue, do not ignore. Do call the doctor, as these could be signs of a serious liver problem. Swelling of the ankles, fingers and face. But if you notice that suddenly there is lot of swelling or you're suddenly gaining a lot of weight, please do not ignore. Call your doctor, as this could be a sign of pre-eclampsia. Hopefully, your second trimester will pass peacefully. Always hope for the best. And now you will be stepping into the third trimester. This is the time you can look forward to your baby kicking you. Besides the discomforts that you had in your second trimester, you may also have some discomfort or difficulty in breathing sometimes. You may also have to excuse yourself to go to the washroom more often. And this is certainly quite okay, because the good news is that the baby is getting bigger and all these discomforts will disappear once the baby is born. So in the third trimester, you may have shortness of breath, heartburn, again swelling of the ankles, fingers and face, hemorrhoids, tender breasts which may leak a watery pre-milk called colostrum. Your belly button may stick out, trouble in sleeping, the baby dropping or moving lower in your abdomen, contractions which can be a sign of real or false labor. And lastly, as you near your due date, your cervix becomes thinner and softer. This is called effacing, which is a natural process which helps to open your birth canal for the birthing process. Your doctor will also keep a check on your progress through several vaginal examinations. So take a deep sigh of relief. I am sure you're going to wade through smoothly. You're bearing a new life, a lovely and beautiful life. After all, motherhood is a blessing and the best essence of womanhood. So celebrate life, celebrate pregnancy. See you soon in our next video, which will tell you more about what happens in the first week of pregnancy. Do send in your views on our email ID given below, and also do not forget to subscribe to our channel. So take a deep breath, chill and relax.